A very warm welcome to the United Nations in Malaysia, represented in this webinar by the United Nations University International Institute for Global Health and by UNICEF. My name is Pascal Alote. I'm the director of UNU-IIGH. UNU-IIGH in Kuala Lumpur, Malaysia, is the designated UN think tank on global health. The Institute serves as a policy translation hub for UN member states, agencies, and programs. The Institute generates policy relevant analysis by applying a gender lens to inform the development, implementation, and evaluation of health programs. We have a critical convening function as well, and one of the regulars is this Working Local, Thinking Global seminar series. This pushes the idea that we are in a globalized world and the context in which we work is important, but lessons from the local can still inform the global. So the aim of the seminar series is to provide a forum for intellectual discussion about the work of the United Nations. It creates an opportunity for bringing together academics, researchers, and civil society across Malaysia to engage with relevant counterparts within the UN country team. Today's discussion is with the United Nations International Children's Emergency Fund, UNICEF, to share their work in Malaysia. Just a couple of housekeeping things before we start. The two anchors for this webinar are Dr. Michael Penkunas, a research fellow at UNU-IIGH in charge of capacity building programs. He will join us later and moderate the question and answer section. Please interact with the moderator and panelists via the Q&A function in the lower toolbar. The second anchor is Basilio Valdehuesa, and Basilio is working in the background to make sure that everything works smoothly. You may log questions via Q&A and Mike will moderate the questions. We have embedded the function to upvote relevant questions. So if somebody has typed in something that is similar to what you might want to ask, please just vote on it, and this gives it priority so that it moves up higher in the list of questions to be asked. There is a post-webinar survey at the end of the webinar. Google form opens automatically, and please take the time to fill it in so that we can provide you with quality events. The webinar will be recorded so it can be made available to those who are not able to join today. And the presentation slides will be shared as well, so watch this space. I will now introduce my esteemed colleague, Dr. Rashed Mustafa. Dr. Rashed Mustafa is the UNICEF representative for Malaysia and Brunei Darussalam. He has about 25 years of diverse work experience in Central Asia and the Caucasus, Europe and Southeast Asia, with UNICEF and a number of other UN agencies in politically and economically transitioning countries and in extreme humanitarian and post-conflict situations. Before his arrival in Malaysia, which is fairly recent, so he's done an amazing job at coming up to speed in spite of the current circumstances. Dr. Mustafa served as the UNICEF representative in the Republic of Belarus, 2015 to 2020, and UNICEF Deputy Representative in Azerbaijan in 2009 to 2015. In both countries, he provided overall leadership and managerial guidance on UNICEF programming, policy direction, monitoring of compliance and performance standards, as well as coordination with international government and civil society organizations. I'm not going to go through his full bio. It is available on the UNICEF website. But I do want to mention that he has expertise working in the former Soviet Union countries for over 17 years, is fluent in Russian, and is familiar with the geopolitical context and social fabrics of the region. Dr. Mustafa, the floor is yours. Thank you.
Thank you. Thank you very much, Dr. Pascal. It's my pleasure today, and I will be going through, as we say, global to local, But before that, I would like to say that how much grateful I am to be part of this dialogue. And the important is that dialogue is how we do convert a evidence to policy making. I will start with a very short presentation, but I will leave longer time for a dialogue and question and answer so that I could learn more from the colleagues who will ask questions. So do you see that?
That's perfect. Thank you.
Thank you very much. So I will be talking about how we engage evidence in policy making in realization of children's rights and sustainable development goals. We'll be talking about UNICEF strategic priorities globally and how we convert it to the locally. We'll talk about some experiences locally and different countries and what are the research have for UNICEF. UNICEF is one of the oldest UN agencies, and this year we will be celebrating our 75th birthday. As you may know that we are born during the height of Second World War, where we were supporting children in Europe, Japan, and other countries where children were devastated into the Second World War. And we were awarded the Nobel Peace Prize in 1965, where we are very, very proud of. Let me share with you our current 5 global priorities that we also convert into the local priorities in Malaysia. We call the first priority, every child survives and thrives. Every child learns. Every child is protected from violence and exploitation. Every child is in a safe and clean environment, and every child has an equitable chance in life. These are our guiding principles that our global work comes to the national level, and our country program are mostly in line with those priorities. Of course, our country programs are prioritized with the government policies, national development plans, and of course the SDGs. We all know that COVID-19 is not new. We're just crossing 1 year of the pandemic, and 2020 was a human rights catastrophe, a child rights catastrophe in the world, and children were the most sufferer in many sense. And globally, we have identified 4 key priorities for 2021. Distance learning to save futures, immunization to save lives, and we are talking about COVID vaccines. UNICEF, together with World Health Organization, Gavi, and a couple of other partners, established the COVAX platform, where the countries are able to tap into life-saving COVAX vaccine and the accessories. Water and safe communities, which is very important for many, many countries. And I think in Malaysia, it's also very, very actual. And the mental health to save families, because as you know that mental health becoming a pandemic now. In 2019, Malaysian Ministry of Health survey says that 45% of the adolescents has some sort of stress and psychological disorder. So this is becoming one of the priorities for even government of Malaysia as well. Global advocacy and priorities. When we talk about drive a global advocacy effort to tackle learning crisis, prioritizing the most vulnerable and marginalized children, and including those who are close to the digital divide, and the people, children who doesn't have even access to digital education system. So when we talk about priorities, we match with the local situation. UNICEF always do the situation analysis for children and women. We did here in 2020. All of our country program priority are derived from global and local realities. UNICEF in Malaysia, our visions, we say that where every child is safe, supported, and nurtured to reach their full potential. We recently have adjusted our focus on sustainable development, child-focused equity agenda, which is leaving no one behind. That means when we talk about every child, we mean every child of orang asli, refugees, migrants, undocumented, children with disability, and we do not discriminate where they're located. They can be anywhere in Sabah, Sarawak, or any other places. We talk about children in Malaysia. And Sabah state is a priority engagement for us because there's a huge number of children, undocumented children there, and they need a very, very important support from all of us. We have changed strategy number 8. That's a very, very important strategy that we focus in. We call it harnessing the power of evidence as a driver to change for children. Let me go to how do we do that? We do the power of evidence and drive changes. We rigorously do evaluations, data mining, data collection, analysis, and research. We bring them in public domain through roundtables. We discuss extensively with government for policy advocacy. We engage our media community. We discuss with public, and we try to craft the policy, a better policy change for children in Malaysia. For example, our study on children without, the UNICEF Urban Child Poverty and Deprivation Study in 2018, it was one of the very good success study. When you will see the link, you could download the study for yourself. I would not go little in details, but let me say that the findings that we are still harvesting on, that the first time we figured out that 15% of the children below under 5 are stunted and 22% children are underweight. This was a very good advocacy tool, and now we are having a very, very mutual discussion with Ministry of Health, and nutrition agenda became one of the priority agenda for the government. The same way that when we talk about out of the school, we speak about 5 out of 6 children do not have access to preschool. When we also talk about the poverty, all these informations generate a lot of policy dialogue and gives us open us a lot of advocacy opportunity. And we are very, very happy that the government of Malaysia, our partners in different ministries, are very much willing and very much engaged with us in policy dialogues. Let me go to the family on the age. I really hope that many of you who are here today have heard about the study of family on the age that we have been doing since March this year. And just yesterday, we launched the 3rd study on the family on the age. This is a socioeconomic situation analysis of 500 households below 40 around Kuala Lumpur low-cost flats. And we are going to them third time, looking at their socioeconomic situation, looking at the children's, looking at their education, their nutrition status, their economic well-being, and social protection mechanism. It generated a huge information about the COVID impact for those 500 families with children. We have seen that the children, the families, the female-headed household families, families with children with disabilities, low-income families are in a great dangerous situation for nutrition status, for education, access to education, and of course, psychological well-being. The last study that we launched, the third one yesterday, showed that half of the families, due to the government's support on government support, could manage to recover some, but 46% of them are even deteriorated from their situation in September. So we found out that there is a great need of families. Those are female-headed household, children with disabilities, and the families who are dependent on the daily wages, daily work, and who doesn't have the work now, are in a great poverty, under poverty. And this study generated a huge public discussion in media, in the parliament, in the Prime Minister's office, in the office of the Ministry of Planning and Economic Affairs. And we have managed to engage the government to discuss and submit our policy recommendation. And I'm very happy and proud to say that we are in a very good understanding on the future social protection package and sustainable policy for these children. You could also browse through the other countries' similar experience in Vietnam, Mongolia, PNG, Nepal. I will not go through them, but they would be available to download and further reading. What lessons we learned during all these years is that continuous advocacy, continuous evidence generation is the key to engage everybody on a policy dialogue, and that's important for bringing the well-being of children and their families. COVID-19 crisis, I would not stop a year longer, but this is something that we also actively discussing with the government, and a lot of policy discussion being engaged. This is what I discussed. It's more or less local, but UNICEF has a global research hub called Innocenti. It's in Florence, Italy. That's our pride, that this research center does global researches that we use globally. They do multi-country research on child poverty, social protection, and all other issues. Innocenti is a research hub for all child rights issues, and the only one in whole UN system. At the end, I would like to mention that our partners globally and here are very much important for us. We are very grateful to the partners of think tank that we do research with, the civil society that we discuss with, and then the government partners that we agree the policy dialogue. So this is a partnership engagement and very much in line with all what we do globally. And of course, our UN partners, UN country team with the different agencies and with the different mandates. So we all together should do better for children in Malaysia. Thank you very much, and I will be very happy to answer any questions, but I'm looking forward for the dialogue. Thank you very much.
Great. Thank you very much, Dr. Rashed. Very nice presentation, a great overview of your work. You certainly have been busy in your first few months in Malaysia. Some of the things that were resonating with me is I did know that this was UNICEF's 75th anniversary, but I did not know you were a Nobel Peace Prize holder. So great to learn something new. I also appreciated your conversation there around the 5 pillars of the strategic plan. I think that really good illustration of the work being done by you and your colleagues at UNICEF. We have a couple questions coming in on the Q&A, so please do use that feature to ask additional questions while our colleagues are typing them in. There was a couple things that came to my mind, and let me read off a couple thoughts and a question from the audience, and then we'll give Dr. Rashed, please, a few minutes to respond. So one of the things you mentioned in one of our prior conversations is that your reach is very wide across the government, and I'm sure it's the same in other locations you've worked in. If you have any insights into opening that black box of policy decision making, that's something that people at IIGH are very keen on learning more about. So tell us, how is it that we can better engage or utilize the evidence at hand to actually influence policy? That's one question from me. Another one is around schools and school opening and some of the really important roles that schools play. So I know, for example, the advisor to the Secretary General noted that the schools are a particularly critical setting for vulnerable children. So what is UNICEF's role in promoting schools during the pandemic? And similar to that, building on that, schools in Malaysia are one of the primary delivery vehicles for vaccines for children. So we have a number of negative consequences that have accumulated due to school closures. Question here from Tiffany is UNICEF keeping track of missed immunizations, and are there any methods that we can work on to best mitigate the consequences of these missed doses? I'll leave you with those for now, Dr. Rashed, please.
Thank you, Dr. Mike. Yeah, let me just little beginning that, yes, 70 years we are celebrating, and today we are in 190 countries and territories in the world, and our agenda would be very similar but crafted according to the country context. And your first question, that how we could partner together. Of course, health sector is one of our core traditional mandate and work area all over the world. And here also we partner with Ministry of Health on many issues. As I mentioned, the nutrition is one of the very important area that we are working on. Another one is the immunization, that the last question, that missing dose and all. I don't know whether we talk about COVID vaccine or the regular antigens, but if it is both, then of course we were talking about the polio outbreak that happened last year in Sabah, and UNICEF brought 2 million doses of that very specific vaccine handed over to the government, and we were working together. And exactly this week, there is a verification mission of WHO and UNICEF in town. They were in Sabah to identify and validate whether all vaccines were properly delivered and is there any future potential of outbreak. So yes, we do monitor with the government, and this is very important role for UNICEF as well. And on the research agenda with IIG, I think that I did have a discussion with Dr. Pascal. We will continue that discussion because research is very important. Malaysia is almost a high-income country to be in a couple of years. If not COVID, they were already been next year. So one important role that we as a UN to play is evidence-based policy dialogue with the government. And that's why our role and our partnership would be very, very crucial. On the schools, yes, I mean, that's a global question wherever UNICEF representatives are. What is our policy on school opening and closure? School open and closure is the government's decision, but our policy would be that children has to be safe. If government decides to keep the school open, then we would like to make sure that that school is safe for children. Means all necessary precautions being taken, the sanitations, the distancing, masking, and everything. And if school is the government decision is the school to be closed, then we would like to make sure that the children has access to digital education, access to learning. So important thing is school, but most important is access to learning at the school or outside school. But access to learning and safety for children is two major concern and positioning for us. Thank you.
Great, thanks for that, Doctor. Another primary activity of UNICEF is around the COVID vaccine effort. So the rollout, I think that's really gearing up to happen in the next handful of months. So I was wondering, could you tell us anything around how UNICEF is working towards rolling out these vaccines through COVAX, and what are some of the equity issues that are being encountered in terms of access for low and middle income countries?
Thank you. It's a very, very sort of discussing questions now. I guess you all know the COVAX facilities where UNICEF, WHO, Gavi, and a couple of other partners have created, and UNICEF is leading the procurement and logistic of that COVAX facility. We have targeted that by mid next year, we will buy and deliver 3 billion doses of vaccines. And target is by end of this year, we will deliver 2 billion doses. Around half of them already committed, and we are continuously engaged. There's a big team working. This is the biggest vaccine undertaking in the world so far, and there will be a $1.5 billion at that moment being transaction now. Equity agenda is very important, and also timing. For here, I just signed an agreement with Brunei government on the COVAX, access to COVAX facilities, and we are under discussion with Ministry of Health Malaysia also to that Malaysia also get the opportunity to get vaccines or to buy vaccines from COVID facilities. The equity agenda is the price and the timing. We are talking about, because the global shortage of vaccines is already there. And then the rich countries and the countries who ordered before, they are getting the vaccine first. So what we are actively discussing with the manufacturer and the policy and the countries, that if the country has country are more vulnerable in terms of cases, in terms of accessibility, those countries supposed to get first. And the countries who are better off in the health system, or the government is already procuring, then this country gets that according to the time frame. So, and also we would like to ensure that there is a accessible price for the countries who has difficulty to afford a high price vaccine in a higher cost. So it's a price, time frame, and access all are around the equity approach.
Great, a lot to think about. Thanks, Doctor. So another question here from our audience, and this goes back to your experience in humanitarian settings and in areas of conflict. So we have currently the coup d'etat in Myanmar, for example. Can you tell us more about your experience working in countries in crisis or in transition, and what that means when we think about championing the rights of the child? And can you give us any specific examples of how UNICEF has to negotiate the politics in a country where there is a crisis or transition might be happening?
Thank you. Very, very interesting question, because I have been working in a conflict and post-conflict countries like Afghanistan, East Timor, the next door, in Kosovo. I've been working in Abkhazia and other countries, Georgia. It's very, very important to engage the government, whoever they are, because children cannot wait. And that's why the countries that I have been working, my first priority was to ensure that the lifeline pipeline of services for children are not interrupted, they're interrupted. That services are ongoing. And then that might need a lot of negotiations. For example, I work in Tajikistan, where I had to supply food to mountain places where there are a lot of so-called the warlords were putting their posts. So I had to negotiate each of them to reach to the villages where the 500 people are starving from food. So the priority is the negotiation, priority is the needs. And of course, the government is important, but which government in power, that goes secondary consideration, but needs and access to the services, access to uplift their rights is important. And that's always what I do.
Great, thanks, Doctor. I wanted to follow up with a question from our audience here. What are some of the priorities for adolescents specifically for UNICEF? And what are any of the activities you'd be able to mention for our audience today?
That's very, very important question. And adolescents are, for us, the most vulnerable, if you could say, because adolescents are not children and they are not adult, and they are trapped due to their age and psychological status. So that's why they need a very, very, they need an unusual, out of the box approach and thinking. For us, we do have a very good programming on adolescents. And mental health is a top priority, as you have seen, that one of our 4 global priorities, because COVID has aggravated the situation at home where the instability, the home environment became more violent, and the children and especially the adolescents are more stressful. So mental health, psychological health, and support is very important. We are talking about access to the skill set development, because not all adolescents become the engineers or doctors or barristers. There are a lot of, there are a big portion who become the who are not getting into the university, but we need to make sure that they do have appropriate skills to get employed. So we call it 21st century skill sets. So we need to make sure that the adolescents do have a skill so that they can find a job. We also talk about adolescents participation and engagement. We do have a climate change program that the recent research that we did showed that 9 out of 10 adolescents care about planet, and they would like to do something. And that's where we are engaging the adolescents in the climate change and environmental programming. Also, the specific the girls, the adolescent girls, we do have a issue of early marriage, as we know that it's not 1, 2, 3, 4. There are thousands, and we do have a very clear, thorough research about that. So we work with the government, we work with the civil society organizations on early marriage, so that the young girls can become a regular citizen and fulfill their dreams. So adolescence programming is a multi-dimensional, multi-sectoral, and multiple partner engaged for us.
Great, thanks, Doctor. We have a couple questions sort of emerging on a theme here, including one for myself. So you mentioned in Malaysia, one of the key activities will be around distance learning. And this also gets to the point of the digital divide. And there's a question here around how can UNICEF look into this issue, particularly around inequalities in access to education. And then sort of along the same line, there's a question here around the engagement that UNICEF does with some frontier technologies. So thinking about other digital resources and artificial intelligence and the work that UNICEF is engaged in.
Thank you, Dr. Mike. This is the question that I am asked often, and I like it, because throughout all research that we did last couple of years, access to education came out very, very highlighted very much. We are currently engaged with the Ministry of Education in developing a digital platform for education, access to digital education. So it's one of the very good initiative, and that would be, that would be very much accessible for all children. However, when we talk about children who are not non-citizen, the stateless children, migrant, undocumented, we are very much attentive to that issue, and we are also negotiating and developing the access of those children, so that they are not staying out of the box, they are not deprived of their rights to education. So it's ongoing, and it would be coming this year. Also, access to technology is one of UNICEF global leadership, because we lead the innovation in many sectors. So innovative idea, innovation and technology is a part of our cross-sectoral programming. Here we also engaging our partner. One of our partner is a DG, with whom we are working on uh, how the technology could be useful and beneficial for children's access to basic services. So I like the question, and this is very much, we need much more discussion from the public, from the civil society and policymakers to make it even bigger and contribution, to have more contribution in this solution.
Great, thanks, Doctor. We have a couple more questions here in our Q&A box. One, if we go back a little bit to our discussion around working with governments, question here is, can you comment on your experience on how you dealt with situations where you encounter resistance, maybe from the government or otherwise, when you're attempting to present or utilize evidence for a policy decision process? Secondly, some people think that working for the UN is easy, but I think the real question is, what would be one of the most challenging experiences that you've encountered during your many years with UNICEF?
Thank you. The very good question about the interaction with the government on policy. When you come with a new idea, it's always not easy to deliver. And also, the government is a big machine, and they have got bigger responsibility. They have got responsibility for all children. And if you come and say, no, I have got 100,000 children of this particular group, and this is a priority, for government, this may not be priority. For government, priority is the bigger all children. So what I'm saying is that there is always two angles to see the same thing, to look at different angle. But most important is that how do we come to a common understanding? And that takes little time. In many cases, we just click with the evidence, like with nutrition, like education. But in many cases, we need time, because there are some proposals, policy dialogue needs money. And for the government to allocate an extra money, there is a process. So it takes time. I don't see that the government or governments are not willing to do things, but is that the states, is that different decision-making process takes time, and sometimes, somewhere we face difficult opinion, difficult mind shifts. And that's not easy. And that's one of the challenge for us, to convince anybody to do something differently, but at the end, it happens. On the challenges working with UN is that, let me say, I worked in many emergencies. The challenges is how do you negotiate again with the people who has very clear mindset of some of their own. When I work in Tajikistan or in East Timor, I had to deal with the people who has a very clear agenda of their own, and they are not elected government officials. They are self-declared leaders. So I had a few challenge of working with them, but so far I learned a lot of lessons, and I think that that would be helpful for me in any time in future.
Great, thanks, Dr. Rashed. I think we're nearing the end of our conversation here. I want to say thank you very much, and thank you to all of our participants for these thoughtful questions. A couple more before we sign off. Again, reflecting on your wealth of experience within the UN, there is an emerging discussion around the relevance of the United Nations, both sort of in this mid to long-term time period in terms of addressing the needs of member states and their people, as well as other international relationships. So the question here is, with the rise of non-United Nations NGOs, faith-based groups, and even militaries that provide aid services, where do you see UNICEF as an organization, say in the next 10 or 20 years? And do you see it playing the same or a similar role, or do you think there's any shifts coming for the UNICEF family?
Thank you very much. I think that the relevance of UN has been discussed for the last 50 years even more. And we still working, and we are still gathering 190, 200 head of the states under one roof. Not this year, but this usually. What the role, the prominent role of NGOs and other aid providers, that's a very good thing. We welcome that, because the complexity in the world are getting more. In any given time, about 50 countries are unstable politically or conflict-wise, and UNICEF cannot really manage to support and serve all of them. So when we see a partner working and dedicated for children, we are very much willing to partner with them, and we welcome them to join us. But UNICEF is the only UN agency are mandated for children and child rights by General Assembly. And we enjoy that leadership for children's well-being and child rights monitoring and advocacy. But we are very happy that we have got millions of partners all over the world, and we have got very dedicated partners in Malaysia, in the States, in Sabah, and everywhere, that we work together. And together we are power. UNICEF will not claim and will not say that we will do everything alone. We need partners, and we will welcome all partners work together. Thank you.
Great, thank you, Doctor, and a fantastic conversation. I enjoyed your reflections on your long history in the UN and in UNICEF, and reflecting on the work you've done with governments around the world. Again, thank you to our participants as well for joining us. There is one last burning question. I believe you've been in Malaysia for, I think, 5 or 6 months now. From the audience, what is your favorite food since you've landed in Malaysia? A hot topic of conversation in the Kuala Lumpur area.
Very, very difficult topic, difficult question, because there are so many favorite food already, and I could not say which one is the favorite, but I like the Malaysian food. And it's close to my own food as well. So I have been out of the region for 20 years plus. So coming back to the region, enjoying the food is a heaven for me and for my family. So we are very, very much into the cuisine, and I think that I hope I will not add another 5 kg when I leave in 5 years. So and taking this opportunity, I would like to thank all participants, our Malaysian colleagues, and all partners that I know so far that have been very, very respectful and very, very helpful and generous with me and with UNICEF. And of course, you, Dr. Mike, and Dr. Pascal and Basilio, very much. Thank you very much. And my team, who has also supported me having this conversation. Thank you very much. And it was an absolute pleasure.
Well, great. Thank you, Dr. Rashed, for this presentation, this dialogue. I think another successful seminar within this series. we are preparing to say goodbye. I believe, Pascal, did you have a final note to make?
Just a very warm and heartfelt thank you, Rashed, for giving us your time. And I believe you'll be handing over the baton for the next webinar series to one of the other colleagues in within the UN country team. I'm not sure who it is yet, but we will announce it as soon as it's confirmed. So thank you very much. And thank you everyone for participating in the discussion. And thanks.
Thank you very much. Pleasure. Thank you.